Hi, I'm Dr. Mark Salzberg, and next on Pet Owners Hotline, we'll be talking about specialty veterinary medicine.
From the studios on the Daytona State College East Campus.
Hi, I'm Dr. Mark Salzberg, your host for Pet Owners Hotline. Our guest tonight is Dr. Jeffrey Peck from Affiliated Veterinary Specialist, and he's here to talk to us about specialty veterinary services. Dr. Peck, thanks for coming.
Good to see you.
I just want to start off by saying we had the very fortunate experience of visiting the Affiliated Veterinary Specialist and seeing what you guys do over there. And I stood in and watched a little bit of surgery. A fantastic practice over there. Tell me just a little bit about, we're getting a little bit of a roll down here and showing some of the sort of the intro there. We got talking here and tell me a little bit about veterinary specialists and what do you guys do?
Well, basically in our practice we've got a fair variety of specialties. We have specialties in, well, I'm a surgeon, so we have specialties in surgery, internal medicine, radiology, neurology. There's also ophthalmology and dermatology in the same area, and oncology or cancer therapy. And when we talk about specialists, these aren't people who just decided, I'm going to call myself a specialist in a given area. What goes along with that, following regular veterinary training, is internship and residency, which adds at least another 4 years to your training, and then passing board certification in your given area of specialty.
Excellent, excellent. Just want to remind you guys, you can call and join the show by asking questions at 1-800-901-9238. So tell us more specifically about, the different services you offer. You told me a little bit about what, all these different things with you, but I know that the internal medicine, you have neurology, and you have all that together in the same place, right?
Yes. So pretty much the same thing that they would tend to offer at most academic institutions. For example, with neurology. So neurology would comprise not just the neurologist doing medical neurology, managing seizures, evaluating cases for seizure disorders, possibly brain tumors, spinal cord injuries, or other spinal cord related problems. And they utilize, obviously, the support services of radiology, which would include MRI and CAT scan, which we have at our office, and internal medicine utilizes, specialties in endoscopy, plus oncology or cancer therapy, and surgery, obviously, which is near and dear to my heart, and I tend to do primarily orthopedic surgery, and we kind of separate orthopedic and soft tissue surgery. And with soft tissue, just novel techniques in management of tracheal problems, what's called tracheal stenting, minimally invasive procedures, laparoscopy, arthroscopy, as well as joint replacement, and then more common procedures like cruciate ligament injuries and that sort of thing.
And now I know you have a lab associated with there, so you can get all your, more specific blood work and stuff like that done immediately, right?
Right. There's basically a national laboratory that has space at our practice, and so we get pretty good service from them because they're on site, and where normally we would have to mail it out. And they're not part of our practice per se, but they are housed within the facility, which makes things real nice for us, and it's also acts as a local service center for the Central Florida, Greater Orlando area.
That's excellent. And then I just wanted to mention, because you also do some post-op sorts of work, like rehab and things like that too.
Right.
I saw that we were there, and I remember seeing that big
the underwater
treadmill,
right.
Which I know is a fantastic thing for getting these dogs up and walking and running and doing all that stuff. But do you use that also for therapy for old dogs too, like with chronic osteoarthritis and things like that, right?
Yeah, we have people use it for various reasons. I mean, obviously for me, I'm using it for rehabilitation of my orthopedic cases. Neurology is using it for rehabilitation of their spinal injury cases, disc rupture cases. But we'll also have people who will bring dogs in that do agility, competitive dogs, competition dogs, that just want to get them in better physical condition. And also basically for weight loss. Some people will bring their pets in as an adjunct to appropriate diet and such that your general practitioner, like you would have them put on an appropriate diet and say, hey, they might do well to burn some extra calories, and the underwater treadmill is a low concussion type way, low impact way for them to lose weight.
That's excellent. Those are fun. I know that those things have made tremendous, improvements in post-op rehabilitation and also rehabbing, for chronic things and weight loss and all those things. We're going to go to the phones. We have a couple calls. We're going to try and answer these calls. Go ahead. Caller, you're on the air. Go ahead.
Hello.
Hello. How are you this evening?
I'm doing fine, thank you. How are you?
I'm good, thanks. What's your question
Good.
for us?
My question is, I have an 8-year-old Shih Tzu, and she's never been mated. And is there going to be any danger in having her spaded at this age?
I would generally say as long as she's otherwise healthy, blood work is fine, and she's in otherwise good physical condition, there's no reason why you should be hesitant to have her spayed. Now, it doesn't have some of the same protective benefits that you would have against mammary gland tumors or breast cancer that we tend to see when we spay dogs before their first or second heat cycle, but another big benefit is prevention of uterine infections that we can see in older dogs, something called pyometra, which can be a life-threatening problem. So certainly valid reasons to do it in addition to just not having your dog going through heat cycles any longer.
Right, and that's a good point. I know we've talked about that in other shows about the benefits of spaying and spaying females and castrating males, whatever, all the health benefits they accrue. But I agree with you. Better now before she gets sick, and then it's an emergency. Right. Okay, so back to you were telling us a little bit about the specialties, and I know that there was a quick overview, and a lot of things were shown on that, but I know that you do have things like nuclear medicine and things like that. Tell me a little bit about those sort of specialty services. We're going to talk about surgery. Don't worry about that. Okay.
Well, nuclear medicine basically is a fairly broad term, and one thing that we have is something called nuclear scintigraphy, which is basically where we're using radioactive dyes, and I hate to use the word radioactive because that often scares people. These are pretty much innocuous to the pets that are getting them, and what we're utilizing that for me, one of the most common things I'll do with scintigraphy is called a bone scan. If I can't tell what the source of a lameness or pain is in a dog, we'll do kind of a broad test called a bone scan where we're looking for areas of inflammation basically within the bone that helps focus my attention more in one spot. But we also use scintigraphy or nuclear scans for evaluation of kidney function, something called a GFR scan, thyroid function, thyroid scans. So there's quite a variety of things for which we use that service. And then radiation therapy, what we have is called a linear accelerator, which is used for radiation for cancer, which is typically just one component of treatment of cancer. There's the medical component, which would involve chemotherapy, surgical component, which would be removal or diminishing the size of a tumor, and then radiation therapy. And that comes in various forms. I mean, sometimes we're treating them for just a couple of doses, sometimes for a 4-week period. And we have a radiation oncologist that basically evaluates the patients, determines who would be a good candidate for radiation. And like I said, it's very often done in conjunction with other treatment modalities like surgery and chemotherapy.
And the benefit of a practice like yours is that you have all of those modalities in one house. So
right.
That's good. We're going to go back to the phones. Go ahead, caller, you're on the air.
Yes, hi.
Hi there.
My name is Carolyn.
Hi, Carolyn.
And we have a 13-year-old Schipperke who has developed a bad cough, and it's been going on for maybe 6 months, but it's in the last 2 months it's gotten a lot worse, and it's almost like a dry cough that he gags and nothing really comes out, but it's very distressing to him, and it's distressing to me too. And we've had him to our vet. He's currently on his shots. He's never been boarded. He's in good health except for that.
A good question. I guess a lot of dogs do develop coughs with age, and there's a long list of possible explanations. Most of the time I know veterinarians will, X-ray the chest just to make sure that there's, no evidence of, things even like cancer or other sort of lung disease that we might attribute the cough to. Some of these small breeds dogs are prone to tracheomalacia, right?
Well, yeah, tracheal collapse, but in a 13-year-old dog, I'd probably also be saying probably a good idea to consider a cardiac ultrasound or echocardiogram following chest x-rays, see if there's any evidence of any dysfunction of the heart muscle that could be causing the cough.
Yeah, so there's a lot of different things that probably need to be addressed, and certainly this is a case where there's too many different things and too many potential causes, some relatively mild that can be dealt with, and some much more serious. So certainly I would suggest that you kind of go back to your veterinarian and see if maybe you can work this up a little further. We're going to stay with the phone. Go ahead, caller, you're on the air.
Yeah, I've been watching your show, and I saw that little video you had in the beginning, and it looked like there was a lot of different specialized equipment, and I was wondering, can animals or pets, I have a dog and a cat, would we be able to get insurance for them?
That's a good question, and it is certainly out there. I would say, at least in our practice, maybe 5% of our clientele have insurance for their pets. Unfortunately, a lot of clients come in with a dog with a fracture or with a cancerous process and say, oh, I want to get insurance now. Well, obviously, you're probably aware that if you tried that wouldn't go over too well with the insurance company either. So you have to be proactive about it and get it before there's a problem. A lot of the insurance companies don't cover hereditary problems, but some now do. The prevalence of it, I think, varies quite a bit location-wise. I spent a couple of weeks doing a temporary faculty position out in Dublin, in Ireland, and about 60% of the clients there had pet insurance, but here it's much smaller, and I think part of it is just kind of the public's fear or mistrust of insurance companies, but a lot of the insurance programs that are out there are actually quite good, and for one problem that we might see, that would probably pay for just about the lifetime of insurance premiums for that pet.
Yeah, I mean, I look at insurance the same way I do in human medicine, and I kind of look at it this way. You pay your premiums, and if nothing major ever happens, you've probably paid more in your premiums than you're going to return. However, one single significant problem where they have to go see Dr. Peck or one of his associates over there, and it could pay for itself. And so you have to look at it in probabilities and chances. I mean, there's nothing wrong with insurance. Again, I view it the same way as us. I couldn't afford to pay for myself if I had to go in the hospital and have something. So I have to pay my monthly or quarterly premiums. Yeah. And the same thing in veterinary medicine. It's all a matter of what could you potentially afford to pay. Yeah. And sometimes they certainly get up there.
And definitely research the company.
Oh yeah, and I know there are several of them there.
Yeah.
And I don't have many, but I'm getting more and more. You know what? I've been seeing more and more. I don't know what percentage, but I'm seeing more and more people that do carry insurance. And from my standpoint, it's pretty simple because they pay me first, and then I send it stuff. I just want to remind everybody that the station is now on Facebook, and you can become a fan by typing WDSC TV 15 in your Facebook search. You can see who is scheduled for next week's show. You can also ask a question, and I will try and answer as many as possible on next week's program. The question received this week is, do you offer cancer treatments? Well, I know Dr. Peck already talked about it, but maybe a little more specific, what sorts of cancers do animals get that can be treated, and how successful?
The type of there's two very broad categories of at least malignant tumors. One is called sarcomas, and the other is called carcinomas. And these are very broad categories. The sarcomas are connective tissue, basically originating from, say, muscle or bone, whereas carcinomas come from more glandular tissues, salivary glands, pancreas, that sort of thing. In general, the sarcoma class of tumors tend not to respond to chemotherapy nearly as well. Now, let me preface this discussion by saying, again, I'm a surgeon, primarily orthopedic surgeon. I'm not an oncologist by any stretch. So I'll tell you the best that I can, but I have a pretty good idea of what we do at our practice, what the other specialists do. So sarcomas may be more effectively treated with radiation therapy, very often combined with surgery. So, for example, a dog that has a type of tumor called a fibrosarcoma, which is a form of sarcoma based on its name, you could probably tell. We might remove all of it that we can see or the bulk of it, and that makes the radiation that follows that surgical treatment more effective in helping control that tumor. And other tumors like lymphoma or an intestinal tumor, we may manage partially with surgery and then follow with chemotherapy as opposed to radiation. And in some cases, all three are involved.
So I guess a lot of people maybe aren't aware that veterinary medicine is sort of stepping closer and closer to kind of what we think of as the human medicine model, in that we do have all these specialties available, that maybe 15 or 20 years were much more difficult to come by. So that's kind of a nice thing, that we have these things that are more local, that we didn't have before. It used to be they had to go to a university,
right,
to a vet school to have any of these things. So that's I think that's great. Now, your specialty is orthopedic surgery. You've said that repeatedly. I think we should have a chance to talk about it, because that's what you like to do. I know I was able to go in and observe one of the surgeries you do. Tell me a little about the surgery I saw, and then sort of more more generally, what kind of surgeries do you do?
Well, this surgery that we're watching right now is for surgical correction of what's called medial patellar luxation. What that is when the kneecap pops out of the groove toward the inside of the knee. It's probably the second most common surgery that we do, behind cruciate ligament or ACL or CCL ruptures. And basically there's 3 or 4 components to the surgery. What you see me doing just in the previous clip was basically deepening the groove that the kneecap rides in, and then we also shift over the attachment of the tendon that goes from the kneecap to the tibia. Those are kind of the 2 biggest components of that. So that's certainly without question one of the most common surgeries that we do.
And I remember this dog in particular, you can kind of see how closely they're monitoring this dog during surgery. I'm just standing there looking important, but I'm really just making sure you're doing your job right, but just kidding. But you have an anesthesiology tech there that's watching, making sure that everything's going okay. You have 2 surgeons that are taking care of, and I think isn't that a resident surgery?
Yes, that's one of our surgical residents. That's Mariana. She's our first-year surgical resident, and we do have interns and residents just like a teaching hospital would have. However, in private practice, it's a little bit more of a delicate situation, so they do not do as much of the primary care as they would, say, at a university, where you may not even know whether it's a resident or a senior faculty member that's working on your pet.
Right. And actually, that dog that we were watching, that was kind of a unique case, and I think it kind of is for us, at least for me, is a segue into sort of other surgeries that you can do. Because I think you told me that dog had a hip replacement before.
That's correct, yes. Yeah.
So you do total hips in dogs.
Yeah, total hip replacements are kind of, for me, kind of my pride and joy, because that's something that I do a fair amount of. And I've gotten to be involved with some education of other surgeons with regard to total hip replacements. And there's not a lot of places that do them. They're fairly intimidating surgery to take on, because for an elective procedure, they have a higher complication rate than, say, a cruciate injury and that sort of thing. But the difference in quality of life that we can achieve with a hip replacement is pretty dramatic. Up until 20 years ago, our only option was a salvage procedure called an FHO, which is where we simply cut off the ball from the ball and socket joint and don't replace anything. Now we're able to do hip replacements, and we've had good systems available for at least the last 15 to 18 years, and they've improved dramatically over the last decade.
And these dogs do very well post-op.
Yeah, I mean, what I tell clients to expect with a total hip replacement is that the hip that gets replaced should function as if it were a normal hip. That's not what we expect, say, with an elbow replacement in a dog or in a person, for that matter. But for a hip replacement, my expectation is normal function.
That's excellent. We're going to go to the phones. We have a few more calls. Go ahead, caller. You're on the air.
Yes, sir. I have an Italian Whippet, and the Whippets. I've finally figured out after 2 years that the dog is smarter than I am. When it doesn't want to go someplace or do something, it develops a limp. The same thing is true if it doesn't like food. It'll mope around and limp, and I don't know what to do about that. It's a very smart dog as far as a Whippet is concerned.
Is it always limping on the same leg?
Always. It never. That's another thing. It never wavers. It just knows what it's doing.
Which leg is it limping on?
On its left leg.
Front or hind?
Front.
On the left front leg. I mean, in an Italian Greyhound or Whippet type dog, I mean, for a forelimb lameness, I mean, there's not a lot that we see. I mean, obviously we see a lot of these dogs with radius ulna fractures, because they have these little spindly bones in their front leg, but clearly that's not what's going on. I mean, could he be faking you out? I don't know that most dogs tend to do that. We can see shoulder instability in a lot of toy breeds, so it is possible that their shoulder is intermittently dislocating or partially dislocating, what we say subluxating. That's possible. And if it only happens when you're asking him to do something he doesn't want to do, I don't know if we should chalk it up to coincidence, or maybe he is sharper than you are. I don't know.
That's a good question. That's a real good question. Yeah. Kind of interesting. I don't know that some dogs will learn certain behaviors that elicit a certain response.
Now, if there's a tug or a pull involved in this at all, another possible cause for a front leg lameness that could be associated with someone tugging on a leash as well is if there's a disc problem in the neck, because if we see a disc rupture that kind of goes off to the side, they can develop what's called root signature, where that disc is putting pressure on the nerve root that goes to that leg. Unfortunately, then you start looking into more aggressive diagnostic workups. I mean, you'd start with just x-rays of the neck, but possibly going on to an MRI or CAT scan from there.
Well, there you go. Good point. And that's kind of a weird one, but it is interesting, as it may be. I said I've seen dogs that have learned certain behaviors when they don't want something to happen. Never a limp, but I've had dogs who start coughing to get attention and things like that, because in the past that has resulted in some sort of reinforcement for that behavior.
Right.
We're going to stay with the phones. Go ahead, caller. You're on the air.
Hi.
Hi.
Yes. My name is Vera. I have a question. First of all, I think that this type of care for our animals is absolutely wonderful. I have a practical question. What are the costs of some of these treatments? Since, dogs aren't covered, animals aren't covered under, Medicare or Medicaid or the hospitalization.
Yeah. Actually, surprisingly, Disney employees, I think, get some degree of coverage for their pets. But it's obviously the cost is highly variable depending on the treatment that's being done. I'd say, the patella surgery that we saw in the video at our practice is a little over $2,000 or so. Cancer therapy obviously varies tremendously with what's being done. Full course radiation could be around $4,500, $5,000, possibly even more. Someone before was talking about something that we don't do, which is bone marrow transplants, but someone mentioned seeing something like that on the news, and that was in excess of $16,000. So obviously there's a tremendous variety of costs associated with the equal variety of problems that we treat. So
a lot of, and I guess surgeries here at your practice are the same thing. It sort of depends on the complexity, the length of time that a surgery would take. A short surgery might be less expensive or ultimately less.
Well, that would seem to make sense, but that's not necessarily the case, because if you look at it this way, for surgery, if I've done something 1,000 times, it's going to take me a lot less time now than it did the first 100 times. And I'm probably better at it now than I was 1,000 times ago. But should I be charging less because it takes me less time? Not necessarily. So it doesn't necessarily correlate to how long the procedure takes.
So surgeries like the patellar luxation, you have kind of a set price. You know how much it's going to cost.
I mean, there are always potential variables, but we have a pretty good idea. And I know how long a typical one's going to take me. I know how challenging might this one be. A patellar luxation we grade on a scale 1 to 4. 1's least severe, 4 is most severe. If I have a grade 4 and it's in a breed that's a little more challenging to treat, like English bulldogs, I know that's going to take me a little bit longer than a grade 2 or 3 patellar luxation in a miniature pinscher.
Okay, good point. So I guess final thing is that there's an incredibly wide variety, and I know that I've referred patients. I frequently do refer patients. That you guys or your receptionists or the clinicians or whatever, or the surgeons are always very good about giving me ballpark, because we always want, you guys I know always want to let clients know, you come over here, this is specially practiced, you're going to get the best care for all these different things. These are the approximate charges, so that when they come in they'll have hopefully an idea about it and are prepared. But it is a tremendous thing, and I thank you for that call. It was a great call to know that these sort of extra special things are available, and that weren't 15 to 20 years ago, weren't available, and they're available on a more local scale rather than having to travel 2, 3, 4 hours, whatever.
Right.
Now they're pretty close, and I know that there's we're very. I as a sort of general practitioner, am very, very appreciative that when I've reached the end of what I can do, I can send to you, and hopefully you can finish it up. We're getting close to time. I'd just like to tell you thank you very much. I appreciate you coming. It's a phenomenal practice you have over there, and I've seen a lot of your work, and I think you're great at what you do.
Thanks.
I want to, again, tell you guys that we appreciate you watching. If you didn't get your questions answered, you can email us at www.wdsctv.org or visit us on Facebook. Dr. Peck, thank you very much for coming.
Thanks for having me.
We appreciate it. We had a good time. And we'll see all you guys next time on Pet Owners Hotline.